Hello friends, meet me again Mutia Fitri Hafilizara. Here I will explain about a blood disease, namely leukemia. What is leukemia? Anybody know? Leukemia is a type of blood cancer that can affect both adults and children. Leukemia is a cancer that occurs when cells in the bone marrow do not develop normally. So, leukemia is a condition when the number of white blood cells in the body peaks to exceed the normal number. This increase in the number of white blood cells makes its function disrupt and disrupts the function of other organs in the body. Leukemia is a disease that can arise acutely or chronic. Types of leukemia include A. Acute lymphocytic leukemia. Acute lymphocytic leukemia is also known as acute lymphoblastic leukemia. Leukemia occurs when the bone marrow produces too many white blood cells, a type of immature lymphocyte. B. Acute myeloid leukemia. Acute myeloid leukemia occurs when the bone marrow produces too many myeloblasts, which are immature myeloid with blood cells. C. Chronic lymphocytic leukemia. Chronic lymphocytic leukemia occurs when the bone marrow produces too many abnormal lymphocytes and slowly causes cancer. D. Chronic myelocytic leukemia. Chronic myeloid leukemia occurs when the bone marrow is unable to produce mature myeloid cells. At the beginning of its appearance, most leukemia do not show any specific symptoms. The symptoms felt by each leukemia patient are not always the same because it depends on the type of leukemia suffered and its severity. Common symptoms that are usually felt by people with leukemia are 1. Fever and chills. 2. Body feels tired. 3. Lower weight drastically. 4. Anemia. 5. Red spots appear on the skin. 6. Nose blood. 7. The body is easy to breathe. 8. Excessive sweating, especially at night. 9. Easy to get infected. And 10. Stomach feels uncomfortable due to swollen liver and spleen. Just like other types of cancer, leukemia can also spread to other organs such as the lungs, digestive tract, hair, kidneys, and testes. When leukemia cancer cells have spread to certain organs, other symptoms will appear such as 1. Great headaches, 2. Nausea and vomiting, 3. Deaths, 4. Loss of muscle control, and seizures. In general, the cause of leukemia is a change or mutation of DNA in blood cells or other with blood cell abnormalities. This disorder causes blood cells to grow abnormal and uncontrollably. So far, the cause of this is not known. However, the researchers suspect several factors might increase the risk of developing this disease. These factors are have at cancer treatment, such as chemotherapy or radiation therapy, certain genetic disorder, exposure to certain chemicals, smoking, and family history of leukemia. Here's how to prevent leukemia that you can apply. A. Avoid exposure to chemicals. Exposure to chemicals such as benzene and formaldehyde is said to increase of a person's risk of developing leukemia. Benzene is a fragrant, colorless, and flammable liquid. This liquid can be found in gasoline and is often used in the chemical industry. B. Avoid unnecessary radiation exposure. Radiation exposure from medical examination or treatment also needs to be avoided as a form of leukemia prevention, such as radiotherapy, X-rays, or others. You can choose another type of examination, such as ultrasound, which is safer. C. Avoid smoking. Cigarettes contain various harmful substances that can cause cancer, including leukemia. Therefore, you need to stop smoking and avoid secondhand smoke as a way to prevent leukemia. D. Maintain ideal body weight. Some studies show that being overweight or obese might increase the risk of leukemia. Therefore, you can reduce the risk of this disease by maintaining an ideal body weight. E. Eating a balanced, nutritious diet. To prevent cancer, including leukemia, you need to eat a variety of fruits and vegetables that are rich in antioxidants, nuts, seeds, and contain healthy fats. You also need to limit the amount of processed and fried foods, unhealthy fat, sugar, and refined carbohydrates. Here are some treatment methods to treat leukemia. A. Chemotherapy, which is a method of treatment using drugs to kill cancer cells. B. Immune therapy or immunotherapy, which is the administration of drugs to boost the immune system and help the body fight cancer cells. C. Target therapy, which is the use of drugs to inhibit the production of proteins that cancer cells use to grow. D. Radiotherapy, which is a method of treatment to destroy and stop the growth of cancer cells by using high-powered radiation ray. E. Bone marrow transplant, which is a procedure to replace damaged bone marrow with healthy bone. That's my explanation of the blue disease leukemia. Hopefully useful, and sorry if there are errors in the delivery. See you in the next video. Bye bye and thank you.